Good afternoon. My name is Melissa Mclaws and I'm a veterinary epidemiologist working with EuFMD. Today I'm going to give you an overview of what is involved in risk management. In risk analysis, risk management typically follows risk assessment and is the stage in the risk analysis process where control measures are identified and implemented. Risk management comprises 4 steps called risk evaluation, options evaluation, implementation, and monitoring and review. The first step is to decide if sanitary measures are needed. This is called risk evaluation. Anytime the risk assessment determines that the risk is greater than negligible, then control measures might be justified. If you are working on an import risk assessment for the purposes of international trade, and your country is a member of the World Trade Organization, then you also need to consider the SPS agreement. Under this agreement, sanitary measures are not justified if the disease is present in the importing country, unless that disease has an official control program implemented in the country. If it is decided that measures will be applied, they should be based on the provision of the OIE Terrestrial Animal Health Code. If, on the other hand, the risk analysis was done in the context of disease control and not international trade, then the criteria for deciding whether measures are needed will be different and will often be based on a cost-benefit analysis or other considerations, such as the government's priorities and mandate. If it is determined that control measures are needed, the next step is to evaluate the options. The control measures taken should make sense in the context of the risk assessment, and indeed the risk pathways are useful as a way to identify control options. Measures should be chosen on the basis of their likely effectiveness and also on how feasible they are to carry out. If you are defining measures for international trade purposes, the SPS agreement and the Terrestrial Animal Health Code also stipulate other conditions, namely that the impact on trade is minimized, the measures applied equally in all situations, and that they do not cause discrimination between exporting countries. After the options have been evaluated and decided upon, the next step is implementation. Policy and operational guidance may be developed by different groups, such as central versus district level. The actual implementation, however, may be done by the veterinary services, through another public body such as border control, livestock owners, or the trading partners. It is also important to consider in advance what records will be kept in order to verify that the measures are carried out as intended. The final step in risk management is monitoring and review. Monitoring refers to the ongoing process of collecting data to see if activities are implemented as planned, and the results of the activities or the impact is as expected. Review, on the other hand, is a periodic assessment that is a more in-depth evaluation of whether the control measures that were implemented were effective in mitigating the risk as expected. Monitoring is done by defining and tracking indicators, which are things that you can measure to check that the measures are implemented as intended. Ideally, indicators will be quantitative or measurable by a number. This is preferred because it's an objective and verifiable measurement. Sometimes, though, it's not possible to have a quantitative indicator, and so qualitative or descriptive ones are used instead. These can be useful for things like raising awareness or assessing biosecurity. When you're determining indicators, it's good if possible to use data or information that's already available. This is because new data requirements or new data collection can be difficult to implement and also very costly. As well as indicators, targets and means of verification also need to be defined. The target specifies the value of the indicator that you're aiming for or trying to achieve. This is often compared to a previous baseline or reference value. The means of verification defines how you will collect the indicators. This should refer to the data source, to the person or group collecting the information, and also the timing of the data collection. Finally, indicators and targets should both be defined using SMART criteria. This considers that the indicators and targets are specific, measurable, achievable, relevant, and time-bound. When you're defining targets and indicators, try to keep it simple. Look for indicators that are relatively easy to monitor through simple data collection methods, and ideally already part of an existing system. I hope that you've enjoyed this presentation. You can download it on the EuFMD virtual learning website and ask any questions or make comments in the discussion forum under the topic Risk Management Principles. Thank you.